Hello, I'm Laura Siminoff, Dean of the Temple University College of Public Health, and joining me are faculty experts Graciela Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. So as our nation has turned its attention away from COVID-19 to other pressing issues, there's a feeling around the country that kind of the virus has got away, or at least that we've got it all under control. But it's also a fact that it's summer. People are wanting to get out of the house and go places and do things, take vacation. So we're going to talk about some of those issues today. So I want to first start with Heather. Heather, is it true that warm weather may be really working to limit transmission of the virus?
Yeah, so Laura, I think a lot of people are wondering the answer to that question, and people have been talking about it for some time that the summer would kind of limit this transmission of the virus. And although it's possible that warm weather may have an effect on the virus, and there's been some preliminary lab experiments that show temperature and humidity could affect the viability of the virus, we don't think that it's going to necessarily slow down the transmission. We do see coronaviruses like the common cold spread less quickly in summer months, and this is usually due to the fact that people spend more time outdoors and less time in close quarters with one another. Therefore, the transmission can be more limited. But really, right now, researchers are doubtful that the summer will drastically slow down the spread of the pandemic. And some recent mathematical models that have come out looking at climate and the effect on the virus have shown that really the fact that humans have no immunity to the virus is the more important factor regarding the spread of the virus, and not climate. And really, we won't see a seasonal effect on the virus until more people are immune to the disease. And we can see this really demonstrated by the fact that we see rapid spread of the virus still going on across the United States as temperatures climb, and also in tropical climate countries such as Brazil.
Mm-hmm. So speaking of warm weather, Graciela, so now that the weather is warm, in fact, currently it's really hot and humid, um, what are the implications for infecting each other with this virus? Can you tell me what you think about some of the large events we're seeing and how we can practice corona courtesy?
Yes. Laura, first of all, I want to reiterate what Heather said. The coronavirus is still here and will not go away because it's summer. Although our highest risk of infection happens usually when we are indoors and we have an extended and close contact with an infected person, being outdoors still carry a risk. Studies show that outdoor transmission is possible. It's much less likely than indoors, but it's still possible. And because the spread of the virus is still possible outdoors, it is best to continue practicing corona courtesy, meaning wear a mask, stay 6 feet away from others, sanitize, and wash your hands often. If you go to a restaurant, for instance, the risk is from other people, not from the food. So it's best to sit outdoors and avoid crowded restaurants where tables are less than 6 feet away. And if you have to go indoors in the restaurant, make sure the ventilation is good and continue taking precautions. If you go to a public restroom, for instance, wear a mask, do your business. If there is a lid in the toilet, close the lid before you flush, and then make sure that you wash your hands before you leave and use a paper towel if possible. If you are at a park, for instance, don't fret about people coming, going by running or cycling, because essentially they pass very quickly and the risk of getting infected is low. However, try to step aside and face away if you can, and try to stay, again, maintain that distance. Barbecues and other social events at parks, if you go for a walk, can be high risk activities, mostly because when you are at a social event, there is plenty contact. And it's hard to wear a mask, for instance, if you are talking to other people and drinking and eating. So make sure that you keep your 6 foot distance from others if you can, as much as you can. Another common summer activity is swimming. There is no evidence that the coronavirus SARS-CoV-2 is transmitted through water, and the danger from swimming in a pool or at a beach is directly from other people, not from the water, therefore. So try to stay or stay away from people at the pool or at the beach, 6 feet away. Don't go into the pool if it's too crowded, and don't linger in the pool. So in summary, what I want to say is keep practicing corona courtesy. Wear a mask, maintain social distancing, that's 6 feet away from people, sanitize or wash your hands frequently. Wearing masks, by the way, also helps you not to touch your face, which is another way you can infect yourself with particles that have contained the virus. And so wearing the mask, social distancing are important ways to control the spread of the virus. These are personal decisions that help the whole community. So don't catch COVID-19 yourself, and don't be the spreader. So those are my pieces of advice.
Okay, thank you. Those are really good rules of thumb. So Heather, I wanted to ask you another question. So some people, including our president, have claimed that when we see the numbers of infections increasing, such as we're seeing in southern and western states, it's really because of increased testing. So do you think that's the case?
So, Laura, this is not a true statement. I could see how some people might think that the number of cases are only increasing because of testing, because if we don't test, we don't know how many people have it, and therefore we could kind of naively assume if we don't test, it isn't there. But you can also kind of look to another common saying of if you don't look, you won't find it. So this is the correct way, I think, that we should look at the spread of infectious disease. We need to be looking for it everywhere, even in people that don't have symptoms. This is the only way we know how we can exactly deal with it and to the extent that it is spread. In this case, information is power, testing is power. And really, if we look at other countries that have the virus more under control, they are testing and tracing and quarantining people. And they test so that only 1 to 10% of those tests are positive, and then they keep testing at that same rate and so that they can keep on top of the virus. So what Donald Trump has said is absolutely not a true statement.
Thank you for that definitive statement about that. So Sarah, speaking of areas of the country that are in the South and the West, like Texas and Florida and Arizona, they've been seeing some pretty alarming increases in cases. It seems that these are areas where people are generally not using masks or practicing any kind of physical distancing. So can you comment on what's the source of this phenomenon? They seem particularly resistant to doing any of these things.
Yeah, I mean, I think, most of us have never had to wear a mask for our health before, let alone have to go wear one when you go to the grocery store. So for most of us, it's just not a natural thing to do. And I would say that, some rebellion is expected, especially the longer we're asking people to wear them. I think in this instance, unfortunately, mask wearing has become more of a political statement, and the communication about wearing them has been very inconsistent. So usually in crisis communication, the most important thing is to speak in what we would call one voice, meaning that the messages at every level from the top to the bottom are all saying the same thing. And that's clearly not been the case here. So you have the president or the vice president refusing to wear a mask, but then health officials telling us that we should. So the optics of it just aren't really very helpful. So I think there are kind of 4 main reasons that people aren't wearing them. I think one is that people just find them uncomfortable. And, I think we can all relate to that. And because we've had some of that inconsistent communication, it's easy to justify why we don't have to be uncomfortable. I think the second reason is that for some people, they think it makes them look weak. They don't want to admit that they're afraid of getting the virus, and to compensate for that fear, they kind of reject wearing masks. Third is that you have some people who think that it's taking away their rights in some way. So even though wearing masks isn't compulsory in most of the US, adhering to these rules may feel like you're forfeiting your freedom. And this definitely seems to be attached to the political leanings, and whether kind of political leaders have made this a rallying cry, which is what we've seen in some parts of the US. So I think that what that we're seeing in the number of states that do have increasing cases now, that the leadership is saying that they aren't necessary, that it is taking away your rights, and that people are, and if that's the case, then people are going to be less likely to wear them. And then finally, I think, just in general, the guidance has been really confusing for people. So within 3 months, masks went from being unnecessary for healthy people to wear to recommended for everyone to wear out in public. And the conflicting guidance kind of has given us whiplash and not understanding and having so many sources of information. And that kind of goes hand in hand with this kind of lack of transparent and consistent communication about masks.
Thanks. I think you're really dead on with that. So, one of the things that happened around the country that really is not COVID is the protests that we've seen. And Krys, we've seen, the protests here in Philly, but really all over the country. But it seems like we haven't seen a big uptick in cases because of it. And so is this because, as some had said, that there's really only really small numbers of people who are susceptible, and everybody else is okay, which is part of the rationale that people have said we should just open up and let the chips fall where they may? What do you think?
I'm so glad you asked, because actually everyone who hasn't had coronavirus is susceptible to contracting coronavirus. Not everyone's going to have it as bad. And if you think about people who are going out to protest, they're not usually going to be your people who are immunocompromised or are likely to have those severe complications. So they might be infected, but may be asymptomatic and not even know to go get tested. Another reason we might not be seeing an increase in cases in Philadelphia following the protests is just because sometimes it takes a while for people to get sick enough for them to feel like they should go get tested. But as for the number of people who are susceptible and its relation to protests, these protests are also happening outside. And if you look at film from these protests in Philly compared to other large cities, people are keeping a little bit more distance around them, and that most people are wearing a mask and trying to carry signs instead of yelling. So people also were being very conscientious in how they were gathering in those protests. So we did expect to see a little bit less of an increase in protests in the Philadelphia area compared with some other cities who were seeing those. But just let me reiterate that everyone who has not had coronavirus is susceptible to it. And just because you're not likely to have a severe complication doesn't mean that you're not in contact with someone who very well might. So as Graciela said, don't be the infection and don't be the spreader.
Okay. So I just want to end by asking a question, or having anyone who wants to comment and weigh in on this. So I was having a Zoom dinner with some friends, and somebody said, well, maybe what we really should do is as many people as possible should get it, and then we'd all have herd immunity. And then even if we don't have a vaccine, it would be okay. And by the way, this is from somebody who is a very well-educated individual who keeps up with things. And so what would you say to that? Because I've heard a lot of this, like everybody's waiting for herd immunity to happen and then things will be fine. So anyone have any thoughts about that?
I have a lot of thoughts on that. I don't know if other
share them with me and with our viewers.
All right. So current guidance shows that our immunity would only last 2 to 3 months, or at least less than 6 months. So it wouldn't help for that long for herd immunity to happen. And it probably would take longer than that for us to even achieve herd immunity, because I think the last estimate was 15 to 20% of New York City has been infected, and they were going through that for 111, 112 days. And of course, during the process of gaining herd immunity, everyone who's susceptible to severe complications would be going to hospitals and seeking intensive care, and we would completely overwhelm our healthcare system, just like what we saw in New York City. but we would see it across the country if we went the herd immunity route.
Right, and I think I did a back of the envelope calculation, and it looked like upwards of probably 4 million people would probably die if we went to the 60-70% needed sort of herd immunity. And as you said, it's not going to last that long, and we don't really know yet if you got it again, whether it would be less problematic for you or maybe worse. I mean, we just don't know, right?
Right.
Yeah,
Any other thoughts about this?
I have a thought that is essentially the number of people who would die if we are trying to achieve herd immunity, but also how long it will take. In 4 months, according to the WHO, we are like 3% in the world. 3% of people have been infected in 4 months. So it would take like almost 3 years to achieve the herd immunity we want. So, and then there will be 40 million people dead. So that's really not the way to go.
Right. I completely agree. So, Heather, did you have a last thought on this?
Well, I was just thinking if we want to, we can look to Sweden because that was their approach, and that has completely failed colossally, and they have a huge higher death rate than everywhere else in the world, I believe, at this stage. So somewhere has already done it kind of in the quote unquote West, and we haven't seen it succeed. So I don't think there's any evidence as to why we should try it now.
Good thought. So this will be our last video for the summer. We'll be back in September. So thanks for joining us. Please remember that even though it's summer, we still need to be very careful. Consider what Graciela mentioned and really follow her advice. In the meantime, please go to cph.temple.edu/coronavirus to view other videos and find links to reliable sources of information. So thanks very much for joining us today.